Hey, Towayn, welcome to the podcast.
Hi, Stephanie. Thanks for having me.
Of course, I'm so excited for this conversation. We had such an interesting conversation, my first acupuncture appointment with you. So I'm so excited to share everything that you have to say to all of our podcast guests or our
Yay!
audience. It's called
I'm excited.
an Awesome. So I'd love to start off with just you introducing yourself, your background, why you got into acupuncture, the whole spiel.
Sure. Well, first I got into massage therapy, which it piqued my interest when I was in eighth grade. A dear friend of mine and I used to give each other amateur massages, and it felt really good. And I'm like, and I'm pretty good at it. So I thought perhaps this could be a career option in the future. But it wasn't until after I graduated from high school that I was walking and I was still trying to figure out what I want to do. Do I want to go to college? Do I want to do this or that? And I happened to notice a flyer on the floor for Heavenly Hands massage. I was living in New York at the time, so this was like a school in New Jersey. And I was like, I'm going to take this as a sign that I should pursue that as a career. I didn't pursue it immediately, and I ended up living at a martial arts dojo in Chelsea, Manhattan, uh, for Aikido, Japanese martial art. I had been there nearly 3 years, and I was planning to eventually figure out what I wanted to do career wise. And massage therapy came to mind again. But before I could pursue massage therapy, I injured my back during Aikido practice. Somebody threw me. It's sort of like judo when you do throws. Somebody threw me, and I fell incorrectly, and I injured my back. And I was like, oh dear. So it wasn't going away after a few days, and someone from the dojo recommended acupuncture, and I had heard about it. I'm like, okay, why not? This is new, and I was amazed at the results I got just after the first treatment. I could feel a lot of relief and mobility. I couldn't turn or twist or just bend over. I had to like squat to pick things up. So the acupuncturist told me, hey, the pain will come back. It will creep back in, but if I can't fix you in 5 sessions, then I'll refer you to somebody else. So by the third visit, I was good, and that was when I was like, okay. He suggested actually that I consider acupuncture as a career. He said I could do this well into my 80s, whereas massage therapy, would take a toll because of its physical nature. So I considered that. I was like, okay. So when I finished massage therapy school, some years later, I went right into acupuncture school, and here I am today.
I also love that you got these signs and you listened to those signs. I mean, what a perfect example of one man's trash is another man's treasure when you literally found a flyer on the floor.
Right.
And
Yeah,
it started
exactly.
leading you down this journey and then your own healing process getting you there as well. You mentioned that you could practice acupuncture later into life. Were there any other reasons that you decided to, well, I guess you do both now, right? Massage and acupuncture?
Oh, I do both. Yeah.
Okay.
Mhm.
And then acupuncture. Is there any other reason why you decided to pursue that as well as massage therapy aside from the longevity of being able to practice it?
Yeah, sure. So the massage therapy school I went to was also a Chinese medicine school at the time, and so they incorporated an intro into Chinese medicine, and I found it fascinating. I literally was. I thought to myself, "Wow, this is very interesting." My curiosity was further piqued. So that basically is what led me into learning a bit more about the theory behind acupuncture. I was like, I want to pursue this. So yeah.
Yeah. So what does the training for an acupuncturist look like? Is it a certification? Is it what's all entailed?
Yeah, so it's a 3 to 4 year program. It's typically a master's of science program. So I have a combined, I went to Midwest College of Oriental Medicine, and upon completion, you get a combined bachelor's of science in nutrition and master's of science in Oriental
Oh
medicine.
wow.
And so that entails, health sciences, anatomy, physiology, pathology, orthopedic assessment, physical exam, etc. So it's pretty comprehensive, along with the traditional Chinese medicine classes, like the theory classes, how the body works, its dysfunctions, and how to treat it from a acupuncture or herbal standpoint. That, of course, would incorporate point location. We practiced on each other as students. We learned where the points, the acupoints are located, how to needle them, etc. Contraindications, when to refer out to doctors. when it's outside of our scope of practice and things of that sort. So we're pretty well trained.
I had no idea you went to school for so long and had a master's to become an acupuncturist.
Hmm.
That's
That's typical. Most states, so there's a regulating body. The NCCAOM is a national body that does the certification for your board exam. So once you finish your traditional schooling, then you also, in order to practice in a state, you need to get board certified. So the three board exams, well, actually 3 to 4, depending if you take a herbal board, then it's 4. 3 to 4 board exams you have to take. Most states recognize this. There's some states where after you finish your schooling, you don't necessarily have to get your boards. But in the state of Illinois, you must be licensed.
Oh, that's so interesting. Sounds very much like physical therapy or something else that maybe people have heard of more often than an acupuncturist. Sounds very similar to the level of schooling that's required.
Yeah,
Yeah.
well, you have to be competent.
Yeah, I guess it makes sense. I asked if it was a certification, and you're putting needles in someone's body, so I guess we
Oh
hope
yeah.
that everyone who's an acupuncturist is very well trained. And so when I came in for my first acupuncture appointment, I mean I was asking you so many questions because before I knew that there was some level of everything's connected and there's energy levels and the needles can I'm going to stop right there because I'm not going to explain it very well. But you did such a fantastic job explaining how there's so many Eastern medicine practices that now Western medicine has studied and there's kind of two different ways to explain how acupuncture works, right? The Eastern and Western medicine side. Could you explain high level how acupuncture works? And if you want to dabble on explaining from both perspectives, that would be great.
Oh yeah, absolutely. Let me start from the beginning. Whenever I treat a patient, especially if it's their first time, I'm happy to explain what acupuncture is, and I usually say something along the lines of, acupuncture is an ancient healing art that helps to boost the body's own ability to heal itself, to calm the mind, reduce pain, and help to normalize various body functions. And from a modern scientific perspective, acupuncture works by stimulating the nervous system. So when you insert very thin metal needles, obviously they're sterilized, into very specific anatomical sites called acupoints. I call them nerve points for reasons I'm going to relate now. When you insert those needles, the muscle and connective tissue that you're inserting it into, there are peripheral nerves there. And when you manipulate the needle, it stimulates the nerve, sends a signal to the brain or spinal cord to produce a therapeutic effect. Um, from an Eastern perspective, from a traditional Chinese medicine perspective, it comes from a vitalistic energy paradigm. So the idea is that qi, or vital energy, the energy that supports life functions, is being stimulated, and they travel in specific channels called meridians that are connected to organs and tissues and so forth. And qi or vital energy also encourages the movement of blood in the body. So the meridians and the blood vessels are closely related. You stimulate acupoints along the meridians and you affect changes in the muscle, the organs, and the blood circulation. So that's the Chinese medicine perspective. In my experience, the meridians seem to correlate to the nerve pathways, because often when the acupoints are stimulated, the muscles will twitch. I imagine when I was needling, you felt that.
Oh
There's
yeah.
some localized muscle twitching, and we know that nerves control and power muscles. So obviously we're affecting the nervous system. But in the ancient times, they didn't have a conception of the nervous system as we do. So this is in my opinion, it's a more ancient way of describing the peripheral nervous system, the meridians. Yeah.
Yeah, and the meridians and the energy pathways that you were describing, that's what I was attempting to say earlier.
Right.
That's the way I had heard of it, as I knew it was like an old age Chinese medicine or ancient medicine way of doing things. And I love that you explained both sides of it because it just goes to show that things that were realized or recognized, started putting into practice thousands of years ago, there was science behind it, but just not the ways of explaining or researching that science that we have now. So it's amazing to see kind of some people say it's a little hippie or a little voodoo or whatever. I've heard some of those phrases being used for Eastern
Right.
medicine, but it's just the ways of describing it before the research could support what people figured out thousands of years
Right.
ago. Really, they're geniuses, it
Right.
seems like.
Yeah, there's a lot of overlap, and that's the difference between studying something in depthly for 4 years and continually versus like just dabbling in it.
Mhm.
So yeah, there's a lot of overlap between the way that Chinese medicine describes the body and the functions of the organs and how we understand the function of the body today. There's obviously differences.
Hmm.
What I do is I work with both, and based on what the presentation of the condition is, I use both to help me get the best effect I can.
Yeah. Yeah, it's amazing to realize how intelligent people were thousands of years ago to have learned these things, even if they couldn't describe
Yeah,
it as we can now.
trial and error, observation, just like how we do today.
Yeah,
But obviously not using a light microscope like what we did when modern medicine started getting a foothold.
right. Yeah. So, what are some of the main things that patients come to you to get help with? What are the most common reasons that you would treat someone?
So the number one reason is chronic lower back pain for someone to come to see an acupuncturist. So it's, in general, some kind of musculoskeletal issue. Chronic lower back pain is a big one. Neck pain is another. Um, Migraines. This is not a musculoskeletal issue, but migraines and headaches are another big one that people come for. Anxiety or general emotional distress. A lot of people are very stressed out from the pandemic or from work, and so they're on edge all the time. It's affecting their sleep or their ability to relate to others, so that they come in for a de-stressing and centering period. People tend to walk out on cloud nine after such a session, which is great. I love seeing that.
Yeah.
Um, the other conditions, digestive conditions like constipation, very good. Acupuncture is amazing at that, as well as nausea. So those are the big ones. The less more common ones are like acute inflammatory conditions like ulcerative colitis. I've had patients, or I've actually treated one patient long term for that, and surprisingly, it was very helpful.
What
Uh,
is it? The
Ulcerative colitis. It's
what?
a non-infectious inflammatory condition that affects the colon. So
Okay.
there's often pain, cramping pain, or bleeding, rectal bleeding, that sort of thing. Um, Basically, there are ulcers or sores in the lining of the colon, the large intestine. It's basically just an autoimmune condition.
Hmm.
So there's a lot of chronic inflammation that's destroying the lining of the colon, and acupuncture does have a effect on the not only the nervous system but the endocrine and immune system. It's called the neuroendocrine immune network. So acupuncture does have a sort of modulatory or regulatory effect on how the immune system will affect inflammation. And I've seen where the patient has less pain, less bleeding, and just feels better. They have full bowel movements rather than loose stool and that sort of thing. So
Wow.
hopefully that wasn't too much information,
No,
but
I think it's
but
great.
yeah.
I would have never guessed that acupuncture could have helped with something like that.
Yeah, exactly. As far as I remember, there are no studies that absolutely say yes, it will help with that. It's still in the preliminary stages, but in my experience, it may be able to. So I wouldn't say acupuncture is your go-to for UC. You would obviously want to see your primary care doctor, but if you're still having some problem with that, you could tie up the loose ends with going to get an acupuncture treatment. You know.
Yeah. And you mentioned that before too, where sometimes acupuncture, like with your example of your back injury after being thrown, acupuncture was able to heal you. But it sounds like sometimes it's also used in conjunction with other experts as well as being part of that team of healthcare experts.
Yeah, it's generally seen as a part of complementary medicine or integrative medicine. So, a lot of even the pain relieving effects for lower back pain, you get better results if it's paired with seeing a chiropractor or seeing a physical therapist or doing some form of therapeutic exercises and stretching. You'll get improved function and further reduce your pain this way, as opposed to just acupuncture, which is we're part of a holistic approach, so we can't just use one thing all the time. You have to, it's multifaceted. So as the body is, so it needs a lot of help.
Right. And I've done podcasts with a chiropractor, physical therapist. I'm a personal trainer and naturopathic doctors. And that's kind of the sense that everyone has said. And so you're just adding to it of our bodies are too complicated to have one person be
Right,
able to fix things that are going on. There's not really a good example of one person being able to fully solve your problems, it sounds like.
right. Unless it's like maybe simple muscle ache. Let's say you have a simple muscle
Yeah.
ache from working out or from being, what is it, forward head posture from being on the computer for too long. Sure, get a massage. and that your muscle pain will go away. But still, you may need to do some desk stretches. I often tell these people do desk stretches, especially if you're sitting like 3, 4, 5, 6 hours or more. But not everyone does their desk stretches. So, but
Right.
what else can acupuncture help treat that I less commonly see? Uh, High blood pressure, especially if they're taking meds. I would always recommend that if they already have chronic high blood pressure, you could take meds, but we could do acupuncture to help reduce the peripheral resistance in the vessels. Because as I said, acupuncture can affect the nervous system. The nervous system affects the dilation and constriction of the blood vessels.
Yeah.
Um, Seasonal allergies. Acupuncture is helpful with that. Even studies have backed this up. Um, and of course, women's health, gynecological issues, fertility, irregular periods, things of that sort. Menopausal symptoms like hot flashes, growing evidence that acupuncture can be very helpful in those areas as well. So, yeah, lots of things it's helpful to do. That's why I say it helps normalize various body functions. I wasn't making that up.
Yeah, no, that's amazing. I mean, there's so many things that it can help with. What does a typical session with you look like? Maybe from an introductory session moving forward. There's so many things that it helps with, so I'm not sure if that's an easy question to answer, but what does a typical visit with an acupuncturist look
Yeah,
like?
so with me in specifics, I can only speak for myself, but this is
Hmm.
probably more or less true for other acupuncturists as well. What will happen is a patient comes in, I try to set them at ease, greet them, make them feel comfortable. Then I go into assessing the severity of the condition. So with lower back pain, which is the most common one I see, we'll talk about their pain levels, what may have caused or triggered it, how the pain is affecting their day-to-day activity, things of that sort. After that, I want to assess the nature of the pain. So is it nociceptive pain? Is it neuropathic, meaning affecting the nerves? Is it inflammatory? When I take all this information together, then it helps me select an appropriate treatment strategy. What acupoints will I use? What is the treatment frequency going to look like? Do I have to make recommendations for dietary recommendations, herbal recommendations, or lifestyle changes? Do I need to incorporate therapeutic exercise? So all that data helps me figure out how I'm going to approach this. Then after that, I basically have a little conversation with the patient about what I think is going on with them or how I think I can help. What acupuncture is, I'll go into, and just like how I explained it earlier today. And then I will tell them, I will leave the room. I'll have you disrobe to your comfort level. I'll be swabbing with alcohol, rubbing alcohol the areas of the body that I'm going to needle. I leave the room. I give them a chance to do that, and then I come in and start inserting needles. I check in with them to make sure that they're fine. Um, Typically, acupuncture is not painful when done correctly, so I do tell them to look out for what I call nerve sensation, and the older term is chi sensation. But this basically feels like a momentary dull pressure or dull ache, a localized muscle twitch, or a traveling electric current along the nerve pathway. All this is good. It means it's working. Or even nice tingling without numbness, just like a pleasant tingling sensation. So I tell them look out for that. That's good. If there's any lingering discomfort after the needle is inserted, let me know. That might just be a little tissue irritation. I can take the needle out or adjust it. No big deal. And most people are like, oh, okay. Once they understand what to expect, they're at ease, and the treatment typically progresses very nicely. After the treatment, we assess to see if there's any reduction in pain or improvement in function. There usually is even after the first treatment for something like chronic lower back pain. Um, and then I set expectations for treatment frequency, and that's basically it. Oh, and of course, I may recommend therapeutic exercise. I usually do, especially in chronic back pain issues.
Right.
I'll actually show them how to do these things. And people who do them regularly, as recommended, notice fast results. People who don't do them regularly, I have to find a way to motivate them. I literally have to come up with like, okay, pair this exercise with brushing your teeth. Associate, link
Mhm.
this new activity that you're doing with something you do on a regular basis so that you don't forget.
Right.
So it's interesting. It's not just being a clinician is like you have to do a lot more work than I initially thought I had to do when I was a student.
Yeah, it takes a lot more coaching than just telling someone. There are some people now I know, but typically they're older. I have some clients that are in their 60s to 80s, and if I recommend that they do something outside of our sessions together, almost every single time they will do them. Now, my younger clients, if I recommend anything, they won't. It
I,
takes a lot more
it
coaching.
does in general. I do recall this remarkable young woman though. She her lower back pain. I think she had an injury, like some kind of a car accident. So there was neuropathic pain. So there was a bulging disc pushing against or compressing a nerve root. So she had some sciatica. We were able to reduce the pain. I gave her the therapeutic exercises, and progressively her pain levels were less and less and less. And she did the exercises as recommended, the right frequency, etc. And I was amazed. Like, wow. And so we're done in 4 visits. 4 visits. Usually for mechanical back pain like that, I would assess at the 4th visit to see if things are going well. And if they're going well, at least a third of the pain will be gone, or we get a functional improvement by a third at least. But she was like, no, I'm good, no pain, it's great. And I'm like, wow, that was so impressed. But because she actually followed, she was in her 30s, and she's like, I
Mm.
shouldn't be having chronic pain. I'm a young woman, so that motivated her to do that, get out of pain, because she had been in pain for like 10 years prior to that.
Yeah,
Yeah,
too long for being in your
yeah,
30s. Well, I'm glad she represents the younger generations well because even I've had chronic lower back pain, and I'll admit, and I'm a trainer, I was terrible at doing
yeah.
my exercises and stretches. I'm a good coach, I'm not a good client. So I'm glad you've had a few that represent the younger generations well. So there's so many things that you mentioned that acupuncture can help with. And are there any studies that really show, or, we've talked about how Western medicine has done more research to really help explain some of the things that Eastern medicine recognized thousands of years ago. What studies or what information is out there to show the efficacy of this?
Yeah, so there are studies. Thank goodness. I would say there are thousands of studies on acupuncture today. Most of them are mixed. Some of them are inconclusive. Some of them are poorly done. Some of them are well done. And they fall into 2 general categories. The first one is we're trying to understand the mechanisms, the biological mechanisms about how acupuncture works. So that's one class of study. The other class would be clinical effectiveness. Will actually work for migraines, back pain, seasonal allergies, and so forth. And I think that's the bulk of the research is on clinical efficacy, if I'm not mistaken. So yes, there are, and I will be sending you links for this so you could post or share with your wonderful viewers. Uh,
Yeah, I'll put them in the show notes.
yeah, so systematic reviews are better than just a single study. Systematic reviews is basically a review done systematically of a number of studies on a specific subject, to basically assess whether the studies are done correctly, review their methodology, and make sure that the outcome or the results are valid. So you do a systematic review that's better than a single study. So there are places you can look at systematic reviews for acupuncture for this or that condition. I've used Cochrane.org, so Cochrane, Cochrane, I believe I'm saying it the wrong way, Cochrane.org. So they'll summarize, you don't have to read through long studies, they'll summarize the studies and basically point out whether or not this was a well done study so that the results are valid, or if it was inconclusive or a poor study, so you can't really say yay or nay on it. More required. For back pain, yes, it does help with chronic lower back pain, not so much with acute lower back pain. With migraines, yes, it does reduce the frequency about by half, and it outperforms a placebo acupuncture and the usual care. So acupuncture would be very recommended migraine reduction for sure. So things of that sort. There are other studies for seasonal allergies. I'm not aware of a systematic review on that, but there are studies that suggest or show that it is very helpful for reducing seasonal allergies and your reliance on medication, histamine blockers and so forth for allergies. So the studies are out there. I usually look at, as I said, Cochrane or PubMed, or I'll just type in scholarly articles, acupuncture for this or that.
Yeah, that's amazing. So you mentioned a lot of studies that prove efficacy in, the migraines and the low back. If people have either one of those, makes sense to come see an acupuncturist. But if they have anything else going on in the body, when would you recommend people come see an acupuncturist?
Yes. Yeah. So generally speaking, I would recommend if you have, symptoms of pain, unease, or, general emotional distress or discomfort lasting longer than 2 weeks, uh, then I would definitely recommend seeing an acupuncturist or a healthcare provider in general, but certainly an acupuncturist because we can help with that. But that's the 2 week marker is important because your body has its own healing mechanisms, and that's why humans are creatures in general can be quite resilient. We can heal ourselves, but sometimes we need a little bit of help if the pathological factors are overwhelming our body's ability to heal itself on its own. We may need a little bit of a boost, and that's where acupuncture comes in, or change in diet, or herbal supplementation, or exercise. Or you may actually need to go in to see a physician. For instance, if a person with chronic lower back pain came in, but they also had loss of control of their bladder or bowels, and they're having radiating pain down the leg, I would definitely say, yes, you should. I can treat you, but I also need you to go to your primary care physician because that may be a
Yeah.
severe nerve impingement of the spinal cord in the lower back region. So they should definitely get that checked out. So yeah, we're trained to recognize when we need to tell people go to the doctor or go to the ER or something like that.
Yeah. But I like how you gave that 2 week marker because people, at least in my experience, do so well with direct advice. And just so often in healthcare, which makes sense, everybody's so different. Everybody's symptoms and what's going on is so unique. There's no really one problem and one cure fixes all. But so you generally have to give the high level of, oh, it depends. We can't really say, can't give you a specific recommendation without seeing you. But I like that 2 week, that's a very finite. If there's something going on, you know your body best. So if something's going on and persists longer than 2 weeks, time to seek
Mm-hmm.
out medical help. And especially if it's pain or something unknown in the body, acupuncture can be
Brilliant.
something to come see. So now especially after our visit, I have talked about acupuncture to several of my friends after we had our whole long discussion while I was on the table and talking away. But I have some friends who are very nervous and scared of needles. I don't care. I donate blood. Will get shots all day long. Needles don't bother me is ultimately what I'm saying. But there are lots of people who are terrified of needles. What would you say for people who have that fear?
So that it's actually rather common to have a needle phobia, and people in general are always ask, "Will it hurt? Will it hurt?" I always people generally, if they don't understand something, there's a lot of fear and anticipation going on, and so my job is to help educate them about what we're doing and what could potentially help them. So I go into a very detailed explanation about acupuncture and specifically the needle size. For instance, it's about the width of your hair. It's very thin. The thinnest needle we have is 0.15 uh, millimeters thick by 30 millimeters long. So it's a very thin needle. It's very floppy. Um, so you're barely going to feel that. So I explained that it's not the same as a hypodermic needle, which which draws blood and is much thicker, right? Because it has a liquid being pulled through it. This is very thin. About 10 to 20 of those can fit into the tip of a hypodermic needle. So very thin.
Oh, wow.
Yeah, very thin. Um, I explain what to expect in terms of nerve sensation, like we did before. And sometimes if people ask, they ask, well, how deep does it go? And I'll tell them, usually about a fourth to half an inch into the muscle layer, so not very deep at all. So we're not puncturing organs, etc. Because that could be a fear. Oh my God, what if they go too deep and it damages my spine or my liver or something like this? It's like, no, we're not going that deep.
Yeah.
So yeah, it basically take the fear out of it. I'm demystifying it. I explain what to expect, what's happening, neurologically, physiologically, etc. And then I explain what their sensations they'll have, and then that usually puts them at ease. And if you're truly needle phobic, then like literally nothing I say, you're just so caught in your head that, oh my God, it's gonna hurt, it's gonna hurt. Then obviously there's nothing I can do. I'd probably just recommend massage, or I do acupressure, just stimulating some of those points with my fingers and thumbs. Or I actually had a teacher who was a hypnotist. He was an acupuncturist, massage therapist, and a hypnotist. And he would hypnotize them if they were interested in getting acupuncture, but they were so in their head that they couldn't
Yeah.
let go and experience it. And that would work. And I actually saw him as a student, as a massage student. He hypnotized somebody. I was trying to do a massage technique that was particularly painful. So he hypnotized my fellow student I was working on. And I was able to do the technique, no problem. And I asked her later, I said, what was different? She's like, well, I was aware of what you were doing, but I wasn't creating a story in my head about how it would hurt or what, anything like that. It was just, I was like, oh, okay. I was sort of like a neutral observation of what you were doing. And I was like, huh,
Yeah.
cool.
I mean, it just goes to show how strong the mind is, where if
Oh,
you
yeah.
believe it's going to hurt, it's probably going to hurt. If you walk into it knowing and are put at ease and are told exactly what's going to happen, your mind won't play those tricks on you. And I can attest as a patient, I had some of those crazy muscle spasms and twitches, but it's not painful.
Right.
It's more shocking and a little, oh, my muscle just kind of squeezed up for a second and then immediately released and it was fine. It was more of an interesting sensation than anything.
Right. There's a bit of a surprise element when your body behaves or you experience new sensations. Oftentimes, especially if it's the first time that a person's getting acupuncture, they will experience what they call weird or strange or different sensations that they've never had before. And I smile. I usually smile and say, yeah, that's acupuncture for you, but don't worry, it's
Yeah.
going to help. And they are very pleased with the results. For acupuncture for anxiety, I love that. That's one of my favorite treatments to administer because people, as I say, deeply relax. Sometimes they get insights. When I do it when I get acupuncture for anxiety or emotional distress, I usually, there's usually initial resistance. Last time there was initial inner resistance to totally letting go. And then eventually just the floodgates open and I literally started bawling and crying and it was a cathartic release. So that sometimes happens, especially if you've been penting things out for a long time. And other times I've had it for anxiety, and I just felt a deep calm and serenity. And I knew it was deep because little mind games I sometimes play when people say something like not mind games, little irritations that will come up when people say certain things. It was like, I saw it as nothing. Like, why did I ever get upset about that? Kind of. So I was like, wow,
Right.
I'm definitely in a deeply calm space.
That's amazing. So, to go ahead and wrap up the conversation here, if there was one or two things that you wanted someone to take away from this conversation about acupuncture, what would you want to just really hit home?
Well, there's nothing to fear. It's typically a painless procedure, minor discomfort, but the results typically outweigh those. A lot of fear is just in our heads because we don't fully understand it. But once we are open to trying something new, then we typically have a very good experience. I would remind people that acupuncture is really helpful for general aches and pains, but also just de-stressing, feeling recentered, but can also help improve various body functions like we talked about before. Um, and don't wait too long to try it. If you're having a pain or any kind of discomforting symptoms past the 2 week mark, consider getting acupuncture for it. You could do your own research, obviously, to see if there's any studies that suggest acupuncture is good for this or that. And then base your decision on that. You can call acupuncturists and find out if because acupuncturists also specialize. So I specialize in treating musculoskeletal pain and anxiety, mental distress. I can treat many things, but I'm really good at those things. So you can find out the acupuncturist specialty and you can try it out and see if it's helpful for you.
Love it. And then if people want to ask you questions or potentially make an appointment with you if they're in the Chicago area, what's the best way for them to get a hold of you, follow you, if they want to ask you questions, if you're open to that, how should they get a hold of you? And I'll link all of this in the show notes as well.
Yeah, so I work in the Chicago South Loop at LNA Healing Studio, and I'm there 5 days a week. You can reach me directly via email at acupuncture@lahealingstudio.com if you have any questions, or call the studio. I'll have all that information for you, and I'm happy to
Perfect.
answer any other questions.
And it's also my favorite place in Chicago. I do all my Christmas shopping there, side note, and everyone there is just so nice and sweet.
Yeah, the studio is amazing. It is essentially a wellness center that is unique in that it also has a retail section, an art section, jewelry, apothecary. We have a fitness center. We have chiropractic, acupuncture, massage, and we have facials. We have estheticians who do skincare. So it's a pretty comprehensive healthcare place.
Yes, yeah, yeah.
Center, that's it.
I love it. It's amazing, and Towayn, I can attest, is amazing. I actually haven't had a massage from you yet, but I've referred people to LNA Healing Studios that you've massaged,
Okay.
and they loved it. So for any of the things, all of the things, reach out to Towayn at LNA Healing Studio, and all that will be in the show
All right.
notes.
It was great talking to you, Stephanie.
You as well. Thank you, Towayn.